Okay. Hi, everyone. I am Ariel Ostad, and I'm joined here with Michelle Rothenstein. It is such a pleasure to see each and every one of you. I've been truly so excited to put this webinar together so that we can connect with you. And I'm just so grateful that you can all join here and be part of this webinar so that we can hopefully just try to recreate some semblance of being with each other. I wanted to do this really foremost just to be able to connect with you all and to be able to just hear so that you can hear what's going through my mind. And when we decided to do this a little over a week ago, I thought what better way to try to also incorporate some information about nutrition. And joining us today is Michelle Rothenstein. She is a well-known nutritionist who is an expert in the field of nutrition, and she'll be talking to us about how nutrition is an important aspect of our health and how in these difficult challenges we can actually make sure that we're eating healthy. As you all know, nutrition is critical, especially in the sense that up until a month ago, heart disease was the #1 killer of in the US. For the first time this month, unfortunately, it's surpassed by, sadly, COVID-19 disease. So let's just get to the point and let's get started. Really what I wanted to focus on in this webinar and to sort of create a framework for our discussion is to talk to you about how really a positive mindset is really critical during this time, and how really there is a connection between our mind and our skin, our mind and our health. I hope each and every one of you are doing well. Let me just briefly start out sharing with you what I'm doing. I think it's important that we can all share in terms of what we're doing. Basically, just to sort of go back to early, sort of actually I would say first week of March, I saw a patient in the office for a routine skin exam who, this was just really in the beginnings of the COVID situation, who happened to call me 5 days later in the ICU with viral pneumonia. He was diagnosed with COVID-19. And I was appreciative that he called me to tell me about the fact that potentially I could have been exposed. And that really sort of woke me up. And I, at that point, very quickly sent my wife and our 3 boys to our country home here in Nassau County in Long Island. And I ended up quarantining myself, hoping that I'd be okay. It was a lonely time for me. I was certainly worried. I was afraid. I had a mindset of trying to be super positive, that it's really important in these situations to stay strong. I ended up somehow developing some symptoms, which to this day, I don't know if it was really COVID, but I started getting some congestion. I started getting some earaches. I started getting massive, severe headaches. In addition to that, I ended up having like night sweats for a couple of nights. And then my blood pressure went through the roof. I suffer from high blood pressure. I have a condition called atrial fibrillation, which is basically irregular heart rhythm. I felt like I developed that for a day because I was kind of in and out of the bathroom, which usually happens to me when I get atrial fibrillation. And I called my doctor. He said really it didn't make sense that I would come to the hospital to get tested. I basically just stayed home and I wrote it out, and I sort of got better relatively in a short time. I want to say in about 2, 3, 4 days. I did not have any of those severe symptoms of shortness of breath, fever, cough, but it really woke me up. I was certainly, I got frightened. I was worried about my health. I certainly was worried about my family, but good news was I got much better. I'm totally fine. To this day, I have not been tested. And eventually, after 14 days of getting better, I joined my family, and I'm just so grateful to be around them. I'm anxious to sort of know if I've developed antibodies or not, but I decided to really do this webinar to tell you what I think, what's helped me, even though I went through a frightening period. And certainly it wasn't as frightening as what you hear about what's going on in the hospitals. And I want to foremost start out by telling you how grateful I am to our essential workers, doctors, nurses. you know, paramedics, everyone, researchers, of what they're doing to try to save lives. And I'm just so grateful for their heroic nature. I'm so grateful for their resiliency. And I wish that honestly, part of me feels guilty that I'm not there helping them. I'm here now with my wife, our 3 boys. It's a bit of a challenge. I have so much appreciation for teachers because we spend some time trying to help our kids being kind of homeschooled now. And it's very challenging for me between doing my telehealth services as well as spending time with kids. But at the end of the day, I am so grateful. I am so grateful to be able to be here, be alive. I have even a deeper appreciation for my family, my children, my in-laws who actually are staying with us. They came here. My wife was going to have some knee surgery before this COVID-19 issue sort of blew up. And so they're with us. They're sort of older in their 70s and 80s. So I'm worried about them. We want to make sure they stay healthy. So on a personal note, that's what I'm dealing with. Thank God everyone's okay. I am so sort of excited to sort of hopefully at some point get back to the office to see each and every one of you. I truly miss my patients. I miss you guys. I love my patients. And I wanted to just create this to tell you what I think is really important. As challenging as it is in terms of having a positive mindset, I think it's so critical. For me, I think just talking to you about, I wanted to structure this really around what I think leads to like sort of an important skin health issues, but certainly what creates great skin has to do with obviously being healthy in general. So for me, what I've tried to do is to try to have my routine. I still wake up early in the morning. I try to quickly work out a bit for like 20 minutes. I certainly didn't have the energy in the beginning, but I find when I do that, it really helps me. So I want to tell you that how important it is that I think exercise is a part of your routine. Obviously gyms are closed, but even if it means stretching, even if it means literally doing some arm exercises, stretching, lifting, jumping up and down, doing some sit-ups, some push-ups, that's going to, I think, really release endorphins and really give you a positive mindset. And I think if I have to give you a triad of what I think is important is physiology. So if your physiology in terms of exercising is critical, I think what you focus on is important. You really want to be able to focus on the positive things in life, your family, your fact that we're healthy, we will overcome this. And lastly, I think the meaning that you give life. And I think it's how you really approach this. If you have that spiritual sense of really telling yourself that not only we will overcome this, but this is maybe an opportunity to now actually sit back and reflect and say to yourself, what do I learn from this? And maybe this was an awakening that we need to be closer with each other. We need to be closer with our even loved ones. We need to be closer with any stranger we come across. And maybe this is an opportunity for the planet to rest a little. So I think those are, to me, important. And we all know through research that how there is truly a mind-body connection. And what I mean by that is, if we're sort of living in a state of anxiety and stress, our body secretes stress hormones. And those stress hormones are primarily cortisol type of hormones. And cortisol is a pro-inflammatory hormone that's released in our body. And what I mean by pro-inflammatory, meaning that inflammation can sort of lead to a variety of diseases, whether it's heart disease, whether someone is genetically inclined to get high blood pressures, that sort of pressure can go up. If someone is inclined to unfortunately suffer from acne, eczema, psoriasis, there is a huge psychological / sort of skin connection. And so what we want to do is to really be mindful and be insightful about how stress can aggravate so many conditions. So by hopefully having that awareness, that insight, we can approach life a little bit better and realize that it's important to be mindful. So what I do once I basically finish my exercise, actually I should go back one step that I do. When I get up in the morning, I meditate. I'll just sit up in the bed or I lay in the bed. I put on my app, which is the Calm app, and I just do my morning meditation. That's something I started about a year ago, and it's made a huge difference for me to be able to just get into my breathing exercises, do some deep breathing, and try to focus on what's important to me and just kind of just let myself be. And obviously the mind wanders and your mind goes into like certainly my mind goes over 20, 30 different places, and I just try to bring my mind back. And I do that for about 15 minutes. That helps me. I get up, I exercise. I've definitely slept in longer than what I usually do. I used to get up really at 5, and now I may get up by around 6:37. I do that. I eat something, and check my emails, check the news. At that point, I try to be helpful with the kids, especially my 5-year-old son. Try to get him on his morning meeting with his teachers, his classmates. And then during the course of the day, between checking emails and really just helping out to be present. And to me, being present is really important. And that's something I'm grateful during these times. So talking to you about this mind-body connection, I think what I've learned in the course of my career, my life is, spirituality is important. So I am grateful to be able to realize that there is, again, this huge connection, what really leads to optimal health is the ability to connect. And so, and what I mean by connection is obviously not only with your family, with your loved ones, with friends. I miss that connection with my patients, hence that's why we did this webinar. And I wanted to just share with you how, that it's, to me, health is not about fixing an illness. It's more about really being mindful about how can we have that interconnectedness. And so I try, and it's not really just, I try to think more than just myself. It's about really going beyond myself. How can I contribute? So some of the things that I think helps me is, this connectedness with friends, family, with my patients, really having a sense of relationships, contribution, growth. So I've spent a lot of my time not just sort of listening to webinars like this, but also to really grow. So I try to read some books. I've watched some movies on biography. And the other night I watched something on Nietzsche. I watched something on Marx. I watched something on Freud. So my routine has been really in the course of a day. Hopefully once 5 o'clock comes around and the telehealth services are over, spend some time with my family, with more time with my family, the kids. We go out for a walk here for about a half hour. So I encourage you to walk. I encourage you to obviously wear your mask and go outside, but certainly walking is important. And then evening comes and we basically cook something together and just watch a movie and then try to go to bed and try to maintain that structure. So to me, like, optimal skin health is not so much about just putting creams on. I wanted to let you know, obviously it's important to, obviously wear your sunscreen in a sunny climate. Obviously it hasn't been that sunny and warm, but to me, ironically, vitamin D production has been shown to be an important aspect of immunity. So hence, it's important to go outside and get some sun, try to get some vitamin D. You can always take vitamin D tablets or, pills. I take 5,000 units of that every day. So to me, it's optimal skin health is, again, beyond just certainly important to wear your sunscreen. It's beyond putting on a moisturizer. I think it's important to do that because our skin, ironically, in this day and age with the challenges of washing hands and washing our, clothing coming in, being sort of obsessed with making sure we're clean, our skin can suffer. So I'm sure there are so many patients who have dry skin, hands, peeling hands. And moisturizing is critical, moisturizing your face. When you wash your hands a lot, wash your face, you're actually removing oils from your skin. You're actually disrupting the skin barrier. Ironically, infections can actually set in more. So I encourage you that in a situation like this, make sure you're moisturizing. So these are the things I wanted to just kind of mention to you. I'm trying to think what else is really important to me in a situation like this. I want to also share with you that I'm so blessed to be able to connect with my patients through telehealth. Certainly we're here for you if you have any questions, but at the end of the day, when I connect with the patients who I speak with, I realize how much I love what I do. And to be able to help them, to be able to support them, um, I'm filled with gratitude because I see how grateful they are when they see me and I'm able to help them. Ironically, I've seen a number of my patients who have suffered with COVID-19, and they are grateful to be here. They're grateful to have survived. Ironically, I've seen some skin manifestations of COVID. I've seen a patient post-COVID who's developed peeling hands, peeling feet. That's something we see from, ironically, from viruses. I saw a patient who had diffuse bumps all over her body, and there were sort of red bumps. And again, that's a sign of like what we call disseminated viral exanthem, where the virus is circulating in one's body. I reassured them, telling them that that's going to go away. And I'm just glad to be here. And for me, is having that purpose. I try to volunteer where I can. I can't be in a hospital, but with the help of my staff, we try to gather some masks to try to send to the hospital. Unfortunately, we couldn't get a hold of any. It's just been extremely challenging, but I've tried to help out where I can through, donating to NYU, the frontliners, and those are things that bring me joy. So what I wanted to just tell you about how trying to sort of live outside of what's important just for me, to try to contribute, trying to help. I took down some notes here that I wanted to share with you. I just want to make sure I went through them. Here I have a list of things, like I said, I want to make sure like I follow my structure, my routine, connection, having connection. I would encourage you, if you can, get your loved one and sort of just dance, put on some music. Music is a huge, huge healer. In these situations, I've also dealt with my patients who are alone. And I think about them and I say to myself, God, these are individuals who are at home alone. They don't necessarily have a companion, but I'm moved by the fact that they tell me that neighbors are dropping off food for them. And yet, ironically, I spoke to a couple of patients today, one patient who suffers from melanoma that's spread throughout his body. And he was just so grateful to be alive. He was so grateful that he can go to his backyard and chop wood. He says he misses going to restaurants. He loves going to restaurants. So I dealt with a patient today who she said she was so fortunate to get her bone marrow transplant 2 months ago, before all this situation arose, because she said that if the virus had only shown up earlier, she would not be able to treat her condition, her blood cancer disease, and she would not know if she was alive. Ironically, with COVID coming later, she's alive. So I think it's important to put things in perspective. I want to tell you that I think what's important is to have compassion, not just for your loved ones, for people, but have compassion for yourself. Don't be so hard on yourself. These are the things I wrote: to be present, listen to inspirational things, and going out to walk. I think it's important to see trees, nature, and then most importantly, and I try to end on this because my time's coming up, I want to give Michelle a chance to speak, just having that sense of gratitude to be alive, to be healthy, and I know we will certainly overcome this, and to be resilient. And to me, so what I wanted to end with is that this skin self-care, which I know we wanted to talk about, is beyond just putting creams on. It's really more about what I call a psychosocial self-care, meaning be aware of what's going through your mind, be aware of just being socially connected. Ironically, we refer to this social distancing. To me, I think a better term is, obviously, as we have heard, is physical distancing. I think it's important to follow that very much, but it doesn't mean that you can't connect with people on the phone. And, on a final note, I hope, I'm just waiting to hear what happens going forward. Hopefully by May 15th, when the order is lifted, I hope we can slowly go back to our lives. Obviously, it's not going to be a V-shaped curve. We're not going to just go back to the way things were. I think there's a new normal here. And I think we will see big changes. I don't know what's going to happen in terms of our patients and how frequently we can see patients, but I know we will exercise incredible care in the office to keep a safe office for you. And certainly come mid-May, we will send an email telling you what's going on with the office. I'm anxious to see each and every one of you and to be able to connect with you. We'll just take it one day at a time and remain positive and have a good outlook. On that note, just truly want to tell you how much I care about each and every one of you, how much my staff and I really are here to serve you and help you, and I hope to see you soon, and be safe, be well. I'll end my talk here, but I just want to give chance for Michelle to speak. Let me just please introduce her to you. I am so proud that she's here with us. Michelle is a registered nutritionist. She is a certified diabetes educator, preventive cardiology dietitian. She specializes in science-based personalized nutrition to optimize health, increase longevity, to stave off chronic diseases, their complications. She uses an individualized approach. I've used her for my patients who have met her and dealt with her and love her for her genuineness, for her authenticity, for her real drive to care and love her patients. So without any further ado, just I'll hand it over to Michelle and let her speak to you. Thank you so much.
Thank you so much for having me here. I'm so happy to be here. If anyone has any questions, please feel free to write it in the Dropbox, and we'll be answering them at the end of our talk. Okay. So I kind of want to start with sharing my screen. 1 second. Perfect. So I want to start off with explaining kind of what happens in the immune response and why nutrition and strengthening your immune system is so important. So in this image over here, where I circled, you can see that when someone gets the flu, they get an infection, they get a cold, their body's immune system causes an inflammatory response to allow for the body to actually heal and recover and create this sense of strong immunity. And when we have a low-grade chronic inflammation, this immune response that's in your body naturally actually doesn't work so well. So you can see that there's a lot of diseases that cause low-grade inflammation. And this is from cardiovascular disease, fatty liver disease, obesity, being overweight, a lot of autoimmune diseases, arthritis, psoriasis, inflammatory diseases that are all posted here. And so what we want, one thing that I want to mention is that we want to reduce inflammation in order to strengthen the immune system so that our immune system can actually do its job in fighting disease. Nutrition is not going to prevent COVID. It's not going to cure COVID, but we can strengthen our immune system so that if we get the flu, if we get COVID, if we get illnesses, our immune system has the power to fight it better and more effectively. So speaking about food in general, these are all pro-inflammatory foods. We have refined sugar, high fructose corn syrup, fried food, processed food, meats, trans fat, saturated fat. And while these may seem obvious, I want to go a little bit deeper of why these are pro-inflammatory. So all 6 of these categories have something called advanced glycation end products. And what that does is when it accumulates in our body has oxidative stress, drives inflammation, and actually has been linked to many cancers and chronic illnesses. So we want to get rid of these. To kind of talk a little bit more about high fructose corn syrup and sugar particularly, it's mostly made, 50 to 55% of it is made up of fructose. And this, and fructose is metabolized in the liver. The liver is the only organ that it can actually metabolize fructose in significant amounts. And when the liver is overloaded with these refined sugars or high fructose corn syrup, it actually turns into fat and promotes fatty liver disease. And fatty liver disease, you don't really ever have, at least in the beginning stages of it, you don't have any symptoms of it, but it causes a low-grade inflammation that can cause a lot of other diseases such as heart disease and diabetes and high cholesterol. Fried food and trans fats are also made up of a type of fat that clogs our arteries. And when you clog your artery, you're promoting an inflammatory response. And so we want to make sure that we're removing these or eliminating or reducing it to the most that we can. Processed meats has the most concentrated amount of advanced glycation end products that we want to avoid. And they're also just very pro-inflammatory. But so while we want to eliminate these, we want to also add in a lot of anti-inflammatory foods so that our body can then, be in the best state to help fight disease, but to also fight the stresses that are in our daily lives, such as that we can't control, like pollution and stress and all the other things in our lives. So anti-inflammatory foods are plenty. I wanted to highlight these 6 in specific. So flaxseed, red cabbage, garlic, arugula, berries, and olive oil. Garlic in particular, and it also is applied to the other allium families like onions and leeks, contain allyl disulfite, which is an anti-inflammatory compound that limits the effects of these pro-inflammatory cytokines. So it actively reduces inflammation. Studies have shown that when people have taken garlic, it also can reduce some plaque in the arteries, and it can reduce the actual swelling that's found in arthritis. Olive oil is high in oleic acid, which is very anti-inflammatory. And if you get the extra virgin cold pressed olive oil, that's where the most polyphenols are. So the polyphenols are the highest antioxidants that will help scavenge those free radicals that could be causing an inflammatory state. Arugula is a subset of a vegetable with nitric oxide in it. Nitric oxide helps vasodilate your arteries. When we vasodilate our arteries, we allow for proper blood flow. So if someone has high blood pressure, if they have high cholesterol, this will help actively or instantaneously reduce that inflammation in our body and allow for proper blood flow and for your body to metabolize and do the function it needs to do. Flax seeds ground flax seeds in particular have a type of omega-3 fatty acid called alpha linoleic acid. And this helps to reduce inflammation in our bodies too. And then red cabbage actually has a compound called quercetin that has been shown to reduce the advanced glycation end products that we found from eating those pro-inflammatory foods. The other thing that red cabbage does is it helps decrease gut inflammation. And 80% of our immunity is in our gut. So in order to make our body be able to fight disease, we need to make sure that our gut is in optimal health as well. These are just a couple of things to also highlight in terms of immune boosting because they work specifically with the actual process of immune fighting. So for instance, lentils is rich in zinc, and zinc is a mineral required for creating T cells. And what T cells do are they're a kind of white blood cell that helps fight infection. Sunflower seeds are very high in selenium. Selenium increases the antioxidant powerhouse called glutathione peroxidase, which helps boost our immune response. Water is a clear help boost in our immunity because it helps remove toxins in the body. Most of my clients are not drinking enough liquids, and it's imperative that during this time we create that positive habit of increasing fluid as well. And not only does it help remove toxins in the body, it actually also decreases salivary immunoglobulins, which plays a role in immunity for the oral cavity and the lungs, and it protects our body in many ways. Cantaloupe is very high in vitamin C. And while many people will run to get emergency C or vitamin C from those stores, those are usually have added sugars in them. And believe it or not, some of them even have high fructose corn syrup in it. So I would rather you get that vitamin C from your fruits and vegetables, and they're in many. Cantaloupe is one of them. And vitamin C is kind of talked about getting so much consistently is because your body doesn't really store it in So you need it on a daily basis. But it also, in research, has shown that it decreases the severity and the length of the common cold and the flu. Onions and garlic are also very antifungal and antimicrobial, and those also boost the immune system. Onions also have prebiotics. Prebiotics help feed the probiotics, those good bugs in your gut, so it strengthens your gut immunity, which is so important too. One of the things I don't feature on this list is vitamin D. Vitamin D is actually very hard to get adequate levels through your diet. They're in small quantities in salmon and sardines and in the egg yolk and in specific types of mushrooms. But the main source is sunlight. And I don't find that right now people are really getting that much. And some people who are using SPF and covering their body is not getting enough vitamin D synthesized in their skin. So for that vitamin, I do recommend a supplementation. And the amount will vary on your current levels. Okay, so now that we spoke about some ways to boost your immunity through food, I wanted to also talk about mood boosting foods. A lot of my clients right now are going towards comfort foods during this time to deal with a lot of their emotions. And there's a lot of foods that can actually help boost our mood. So I encourage incorporating this as well. So one of the reasons why what we'll talk about is these certain foods will help with the production of serotonin and dopamine. So serotonin helps regulate anxiety, happiness, and mood, and low levels have been associated with depression, whereas normal levels have been shown with an increased mood and happiness. And like Dr. Ostad had mentioned before, getting that exercise, the meditation, the exposure to sunlight outside will help boost serotonin. So will a lot of foods. One of the ways that we can increase serotonin is by having foods that have tryptophan in it, because tryptophan makes serotonin. And this is found in pistachios, which is one of the things that's featured here. And a couple other mood boosting foods are salmon, which has your best bet of omega-3 fatty acids. When we eat omega-3s from animals, well, primarily fish like salmon and sardines, it will increase our EPA and DHA levels, versus when we get it from a plant-based source, the conversion is not as good. So I encourage a lot of fish consumption if you can get it too. Yogurt is a great probiotic. Probiotics actually increase dopamine, which is critical for mood function. And pumpkin seeds contain magnesium in it, which helps to regulate neurotransmitters and also increase energy. Asparagus is high in folate, and folate supports serotonin regulation. Lastly, green tea. Green tea could be relaxing in and of itself, but it also contains L-theanine, which increases that dopamine production. I thank you so much for having me here. We would love to answer any of the questions that you have. Please just write them down below, and Jasmine will help us with that too. Thank you so much.
Michelle, thank you so much for that brief, yet very, very insightful talk. That was great. One thing that you did say that I think is important is how I wanted to just elaborate on what you said about vitamin D. Here as a dermatologist, I always tell my patients, obviously wear your sunscreen throughout the day. It's so important to prevent skin cancer, but yet this is where, as you said, vitamin D production is essential, and the majority of it is really produced by sun exposure. And yet, as much as we can obviously take vitamin D supplementation, we can obviously take foods that are rich in vitamin D, it's important to go outside and get some sunlight. I think it is important. I usually would have told my patients, go get 20 minutes of uninterrupted sun exposure, but yet, given the current situation, it is important to not only go outside just for your mental sort of health, but also for your skin health. And vitamin D is critical. So I don't think this is a time where you want to worry about putting on your sunscreen. Along with those things, I think some of the things that are important just for obviously protecting ourselves from the virus, but also I think it'll be good for your skin is certainly vitamin C. There are products that you can put on your skin that have vitamin C in it as an antioxidant, but certainly antioxidants help with your immunity as well. So taking a vitamin C is important. That was a beautiful talk. I appreciate it. I think we're all saying how important it is that nutrition and your mindset go hand in hand in keeping you healthy. I want to just open this up to questions that people have. Jasmine, who some of you may know, will just kind of look at the questions that you have entered, and please, we encourage you to ask questions. We would love to hear from you. So I'll leave it up at this point to Jasmine to sort of go ahead and ask those questions, and we'll answer them.
Thank you, Dr. Ostad. So we're going to start off with our first question, and it is related a little bit to what you just spoke on. And it was, is SPF still important if we are indoors all day?
All right, so great question. The question was, is SPF sunscreen still important indoors? And generally, let me answer that in two parts. If we just kind of not talk about the COVID-19 disease, visible light, which is indoor light, does definitely play a part in causing sun damage. There's more and more studies that are coming out that say that it is not just ultraviolet light, so it's not just sunlight that causes sun damage. It's not just the UVA and UVB rays that are emanating from the sun that do lead to sun damage, collagen loss, and certainly skin cancer, but visible light is playing an important part as well. So don't forget, light obviously travels through the glass anyway, so through your windows. That's obviously ultraviolet radiation, but visible light, which is light indoors coming from your ceiling, from your lamps, they do actually eventually reach your skin and penetrate and can lead to some collagen loss and, more importantly, sun damage. So if you really wanted to be extremely obsessive and careful, yes, of course, then you would say, let me wear my sunscreen indoors. And certainly that may be an issue for somebody who unfortunately suffers with a lot of skin cancers. But I think in this climate where we need our vitamin D for our immunity, I think I would say to you that it's important to approach this by not in a more obsessive way, but to say to yourself, well, I need my vitamin D. So generally in a situation like this, I don't think it's necessary. I certainly, if you're sort of sitting next to a lamp that's shining on your face, and let's say you're sitting on the couch and reading books, and then I would say in that case, be careful. You may want to wear it for a few hours a day. I don't think it's that important.
Awesome. So our next question, Michelle, is drinking wine okay when we're staying home more?
That's a great question. So it really depends on how much wine and if it was part of your routine prior. If you want to relax with a glass of wine, a couple nights a week, that's okay, as long as you're sitting, getting it to the standard amount. So for a woman, that's one drink once a day, but not every day. And for a man, it's 2 drinks once a day, but not every day. And the quantity will matter. So if you're filling up a whole glass of wine, that's 2 servings as opposed to the regular 5 ounces. So I would be mindful. It can also lead to weight gain if you're overdoing it, and that's something that we want to be very cautious about. And it also depends on your past medical history and how you tolerate wine. A lot of people who have AFib or who have high blood pressure, who have cardiomyopathies, they can't have alcohol because it will actually cause an AFib attack, and we want to make sure we're preventing that. So it really depends on the individual, and it depends where your starting point was. If you were drinking it prior, you can have it occasionally, but I wouldn't encourage you to pick this up as a new activity.
That's awesome. So then next, Dr. Ostad, they want us to know if you could go a little bit more on your mind-skin philosophy.
Absolutely. I'm firm. I'm a huge believer in the connection that exists between our emotions and our skin. In day out in the office, I see patients who have skin inflammation that presents itself in a variety of different conditions, whether it be acne, eczema, psoriasis. I even firmly believe after 23 years of practice that there is a connection between the number of skin cancers that a patient gets and their mindset. I've just noticed that. And I've noticed that patients who tend to be more anxious, that tend to suffer with more anxiety, I feel like I see them more in my office with skin cancer. Now, I'm not a researcher. I haven't done those studies, and certainly people who get skin cancer are generally people who are fair-skinned, blonde-haired, blue-eyed, who've had a lot of sun exposure as a kid, so they have that baseline genetic predisposition. But I believe in the power of your emotion, and I believe in the power of your mindset. And that's because our brain, basically when it's in a fight or flight mode, it certainly secretes a lot more pro-inflammatory neurotransmitters. One of, and there's a bunch of them, but certainly your body also secretes, your brain signals your organs to release cortisol. That's really signals inflammation. Inflammation basically has cortisol suppresses our immune system. So cortisol is able to sort of modulate our immune system in a negative way. And when our immune system drops, we are certainly prone to more infections. And therefore we can basically catch more diseases. I've seen people who, with basically with more stress, their inflammation gets worse. So with the release of cortisol and suppressing the immune system, you can potentially get more skin cancer. With more inflammation, your acne can get worse, your eczema can get worse. Certainly psoriasis can get worse. And so I think when you're able to control your emotions and have a little bit more, a better mindset to be able to be aware of that issue that someone may be struggling with, you have the ability to hopefully be more mindful about that. And it's not just about necessarily taking like an anti-anxiety medication. It's about exercising, some of the physical things you can do. It's about really reading something inspiring. It's about really focusing on what is it that's creating conflicts and hopefully working on to resolve those things. So studies have definitely shown that there is a mind, body, as well as skin connection. And it's really up to us to hopefully be more mindful. One of the things that I've actually consulted with, I saw a couple of patients this past couple of weeks with hair loss. And there is a huge connection with your emotions and hair loss. So people who are under more stress, the cortisol that's released in our body gets converted into a metabolite of testosterone called dihydrotestosterone. And that actually, for people who have a predisposition genetically to suffer with hair loss, their hair sort of falls out. So I've dealt with that on telehealth visits. So I try to bring some insight into how stress can really contribute to that, and hopefully patients can become a little more aware of that.
Awesome. Okay, so Michelle, question was, what do we need to take with the vitamin D for proper absorption?
Good question. So vitamin D is a fat-soluble vitamin. In order for it to be absorbed, it needs to have a fat vehicle to help with its absorption. So you could take it with food, you can take it with a healthy fat source, such as a couple of nuts, to help with its absorption.
Okay, thank you. Okay, so for Dr. Ostad, question was, if I discover a potential skin cancer, what do you suggest for the short-term care?
Yeah, another great question. So we've seen that as well on our telehealth visits these past few weeks. So foremost, do not panic. Foremost, know that majority of skin cancers, which are basal cell carcinoma, squamous cell carcinomas, are generally slow growing. They're not going to really put your health at risk over the next couple of months by waiting. So number one, I would encourage you to do a few things. Number one, no reason to fear, no reason to let fear take over. That's just going to make you more anxious. I would say to you, hopefully we can see you in the office come, let's say, mid-May, if not June. And certainly feel free to obviously come in, let us evaluate you. But even if there was a skin cancer, so the question is that what you're dealing with, skin cancer? Hopefully it's not, but even the worst case scenario, if it was, it's definitely treatable. It's not going anywhere. The worst type of skin cancer is melanoma, which is an irregularly shaped, multicolored or dark pigmented lesion on your skin. In a worst case scenario, even melanoma, which happens to be the most dangerous type of skin cancer, even that in the next 2 to 3 months truly will not put your life at risk. So do not panic, do not worry. You're welcome to take advantage of our telehealth visits that are available. You can call the office and schedule an appointment, and I can see you either on Zoom or FaceTime and reassure you that hopefully it's nothing. But in a worst case scenario, no reason to panic. There's plenty of time. We will take care of you. Really, at this point, it's important to keep yourself safe, healthy, in a positive mindset, and just try to, hopefully we come to some terms in terms of what's really going to happen with this virus. Hopefully the numbers will continue to sort of go down. They're plateauing. Hopefully there'll be tests in terms of checking for antibodies, and certainly long-term, hopefully we'll have what we call herd immunity, where majority of us are immune and we can slowly resume some sort of normalcy. But for now, please, no reason to worry.
Okay, great. So, Michelle, can you point evidence that you need to get omega-3s from animal sources?
Good question. So I'll be happy to provide you with some research studies for the specific individual to just like email me, and I'd be happy to. But to kind of just give an overall understanding. So when you have plant-based foods like flax seeds and walnuts, which have omega-3 rich components, they are in the form of alpha-linoleic acid. In order to convert alpha-linoleic acid to EPA and DHA, you have to have an exorbitant amount of it. So I'm not saying that so in order for you to get the amount that's required for you to benefit from the anti-inflammatory components of EPA and DHA, you would need to eat a lot compared to if you had it in fish products. With that being said, though, they're not something that, oh, well, then why am I having them anyway? For instance, flax seeds have lignans, they have phytoestrogens, they have antioxidants, they have other components, and alpha-linoleic acids have been shown in research to help with decreasing risk of heart disease and inflammation as well. So it's still a great source of food for you to eat. But in order for you to get the EPA and DHA that we want to require for that really big balance of omega-3 versus omega-6 fatty acids in our body, it's hard to get it from plant-based sources alone.
Thank you, Michelle. So Dr. Ostad, I have a question that you mentioned a meditation as your daily routine. And do you have a specific app and the name of that app?
So I got it, absolutely. I'm happy to tell you what I do. So I got into meditation a little less than a year ago. And I, as a physician, being sort of having a Western style medical education, I used to poo-poo stuff like that really promotes spirituality. But I'm a spiritual person. I got into it. My wife actually introduced me to it. And it's made a huge difference in allowing me to sort of be more focused, calmer, happier. And I started out with an app called Calm, C-A-L-M. There was basically a 30-day meditation introduction. And it's a 10-minute exercise that I did every morning, and it helped me dramatically. I love it. And from there, I've tried another app, which is basically Oprah and Deepak Chopra's app. It's about meditation, and there you can go to that app. It's called Oprah Winfrey and Deepak Chopra. And I've taken a variety of their classes where there's like nighttime things, daytime, and that's helped me. There's another person called Joe Dispenza that I've listened to as well, and I love his meditation. I highly encourage you to do that because it can help you sleep at night. It can help you just be more focused, more energized. You really develop this ability to be even more in touch with your surroundings, and things don't bother you as much. So it's helped me, and those are the things I use.
Awesome, thank you, Dr. Ostad. So Michelle, the question was if you could maybe just talk a bit about sleep and nutrition.
Sure, that's a great question. So sleep and nutrition are very correlated. for many reasons. Primarily, when you don't sleep well, your cortisol levels are increased, but also your body's ability to tell you when you're hungry and full don't work as well. So your ghrelin and your leptin hormones that tell you when you're hungry and when you're full are actually not active as much. And what happens is then you are overeating or undereating depending on the individual. And this can also have impact on your metabolism. So it's important for sleep for hunger and satiety regulation. It's also important for sleep because when we aren't sleeping well, we tend to not choose the best foods for our body. Because we're looking for ways to stay awake and to fuel our brain. And the way that our brain fuels is primarily with glucose. So we go for the comfort foods. We go for a lot of carbohydrates in order for our body to stay awake and stay focused. So it's important that we get the sleep. And there's been studies that show the optimal amount of sleep is between 7 and 8 hours, depending on the individual. Studies have shown that less than 6 hours has shown an increased risk of heart disease, heart attacks, and strokes. And people who have more than 9 hours also have a very increased risk of chronic diseases like heart attacks and stroke. So that 7 to 8 hours is optimal. And it's also optimal in terms of quality and quantity.
Thank you, Michelle. Dr. Esther, you mentioned earlier that you've been keeping yourself occupied with certain activities, and that was watching some movies. And someone was curious if you could share a couple of your titles that you may have watched.
So I love biography documentaries. I love to learn history. So let's see, the past couple of nights. So last night we watched Michael Jordan. So that was like an ESPN thing. My kids were around. So we watched the first and second episode. So I learned so much about his upbringing. I learned so much about how he had just an incredible sort of parents who supported him and how they were instrumental in actually helping him be where he is and how he, so that was one thing we watched that's what we watched last night. We were watching a movie before that my wife had put on, and honestly, I don't remember. It was about life of high school kids, and we have one of my oldest son, Mark. He's in high school, so we happened to be watching that. I don't remember the name, but the night before, I watched something on Freud. It was fascinating. The night before that, I watched something on Nietzsche. The night before that, it was on Marx. And we watched some crappy ones too, tell you the truth. But what else have I seen that I loved? Trying to think. Can't think of any other ones, but that's one thing that I enjoy. We sort of gone to the routine of doing that. So I think routines are important. Our 5-year-old kind of stays up with us. So it's a challenge in terms of having him allow us to watch the movie throughout. So there's a lot of interruptions. He gets hungry and then he stays up, and then in the morning it's a challenge getting him up for his routine class. But those are really what we do to try to have us, keep our family going. And as I said to you, in the morning, I get up, I do my things, and then the challenge of balancing being with kids and going out for a walk. Those are the things we're trying to do. And again, I'm just so grateful to be okay and having everyone in the family be okay. And my mind and thoughts are with the frontline workers and the numbers. One thing that I've learned sort of to not do as much as I was doing in the beginning is to sort of read what's happening in the news. I look at it in the morning. I can't help but to look at it a little bit in the afternoon, and certainly I do it a little bit before I go to bed. But I'm just so moved by the heroic nature of our communities and how they come together. I love that 7 p.m. where everybody comes out and sends their love and their appreciation to the essential workers. And I'm just so moved. I feel like as much as we're all going through difficult times, we're going to come out of this stronger. We're going to come out of this better people. And and hope that we overcome this sooner than later. I know we all need a vaccine. I know we all need that antibody testing. I think we all need to get tested to see if we're, there's asymptomatic carriers. There's all these things that I think each and every one of you know, but I think ultimately we'll have that semblance of normalcy when everybody can get tested to know if not only are they carrying it as an asymptomatic carrier or getting the antibody testing. You read about how there's so many different tests that unfortunately the FDA is allowing to be used, but then we're finding that they're not specific or sensitive. They only carry a very low specificity, meaning they're not accurate. So at this point, I'm just kind of taking it one day at a time. I was telling my staff on our morning call, we have a morning call with my staff, that, I applied for the loan to be able to sort of bring my staff back full time. They're all working staggered in terms of their hours. And unfortunately, I didn't get anything in the first round. So we're waiting for the second round. So there are challenges of that. By the way, I am so grateful for my team. I am indebted to them. I have the most phenomenal team anybody can ask for. So I enjoy being on the call with them. We're all trying hard to see what we can do for our patients. Those are the things I'm dealing with. Nowhere as what other people. I'm just very grateful about doing what we're doing.
Thank you, Dr. Ostad. So Michelle, going off of the vitamin D, someone is asking if the D3 is the correct type of vitamin D that they should be taking, and also that they also take some vitamin C for about past 40 years, and they want to know if taking a lower dosage as opposed to a higher dosage is recommended.
Great questions. So yes, the vitamin D3 is the best one that's absorbed in your body in terms of a supplementation. In terms of vitamin C, so I want to just kind of preface this. A lot of times people will say, oh, well, I'm taking all of these supplements, so I don't need it in my diet. When we look at the research, when you find these vitamins in foods, they're not in solitude, right? Vitamin C is with a lot of other vitamins. It's with a lot of fibers. It's with a lot of phytoestrogens, antioxidants that all work together to boost your health and boost your immunity. So when we take it out and synthetically make it, we don't know its effects. That's A. And B, the supplement industry is not regulated. So I really want everyone who's taking supplements to check for third-party testing. There's a seal that's from the USP that has a third-party validation that everything that's actually in those vitamins are what they write on the label. They're not regulated by the FDA, so they can put anything in it, unfortunately. And there's been a lot of consumer reports that have shown that some vitamin companies have even put fillers that are cheap, like arsenic and lead, into supplements. Supplements also get metabolized in your liver and get excreted through your kidneys. If you take extra dosages, it can cause some more damage than good. So I would really look and see, are you getting it through your diet before you just pile on a lot of supplements? And if you can get it from your diet, that's the best way to get it. I think the 1,000 milligram dosage was looked at as with a big question mark, because we've been seeing a lot of people who have extra amounts of vitamin C could have some extra pressure on their kidneys, causing kidney stones or causing kidney damage also. So I would take caution with supplements in general. Make sure they're from a good source, and try getting it from the nutrition first.
Thank you, Michelle. That's awesome information. Dr. Ostad, we have someone that's asking a ventilator question according to COVID-19. So they understand that ventilators do take care of sending oxygenated air into the lungs, but does the ventilator also assist on the exhalation?
So that's a great question. I am not a respiratory therapist, nor am I like a pulmonary critical care physician, but from the knowledge that I have, I can tell you that unfortunately, when the virus gets into the lungs and produces a lot of inflammation, causes a lot of inflammation, that inflammation basically can act as a barrier from proper oxygen going from your airway into your blood to be able to get oxygen into your organs. So at some point, if the amount of inflammation is a lot and you develop what's called acute respiratory distress syndrome, or ARDS, where you're not able to properly get oxygen in your body, then that's where ventilation, a ventilator is necessary. And for that, it requires that basically the doctor, the ICU doctors, unfortunately, paralyze your body so that the ventilator takes over. And you need to be intubated. The intubation, basically the ventilator is attached to the intubator, and oxygen is delivered into your lungs. So the ventilator basically acts as your external lung source, and it's delivering oxygen into your body. The problem is that if the ventilation is not adjusted properly, you're just blowing air into the lungs. And that's where sometimes, unfortunately, a ventilator can damage your lungs because it is producing forced air into your lungs, which can lead to a variety of these issues where the sort of the airway, the cells dry up from the air, and you're not getting proper lubrication of your sacs, they're called. So ultimately, the machine is breathing in for you and is breathing out for you, but yet you have to be able to do it in a gentle way where you're not damaging the airways, because the ventilation itself can actually lead to potential issues down the line. And that's why once you get on a ventilator, your survival rate can actually go down. Ultimately, you know, it's the last resort, but that's what I know about it. And that's why, as much as obviously people want to, you know, would say, let me go to the hospital, sometimes you're better off if you're able to breathe on your own, that you can stay at home. Some, you know, I've heard news that people, you know, try to, you know, through the help of their physician, get what's called nebulizers, so that you can actually breathing air that can open your airways, and what it's basically, so ventilation is not necessarily the greatest thing.
Thank you, Dr. Ostad. So, Michelle, there's someone here that said they eat very well, but there are any particular foods that can help with sleep?
It's a great question. So a lot of times people will ask about sleep, or they'll say, you know, every person is very individual. So what I do is I assess people's diets for any nutrition deficiencies and nutrition excesses, and then determine what a lot of times what they're deficient in, and add that back into their diet based off of what foods they like. And what I find a lot of the times is people crave certain things because they're deficient in a certain nutrient. And there are a lot of foods that can help promote sleep, based off of making sure you're not deficient in any certain vitamins and minerals, and B, also having a certain amount of magnesium. I think 95% of Americans are deficient in magnesium, and magnesium-rich foods have also helped with melatonin production, which helps with regulating sleep. Also, making sure that we're having enough foods that have tryptophan in it also can help with sleep too. There's also been a bunch of studies that have mentioned if you pair a protein and a carb at the meal before you go to bed, that can also help with sleep. So there are many different parameters. It also might be, are you having trouble falling asleep? Is it that you wake up frequently? What might be the issue? And that can also be addressed based off of assessing you specifically. But from the start, I would say focus a little bit more on magnesium-rich foods. Those can be things like pumpkin seeds, sunflower seeds, tofu, black beans, quinoa, and things like that. So it's a really big evaluation of your lifestyle and your diet in order to pinpoint what it might be. But there is definitely a correlation between a lot of nutrition and sleep quality as well.
Thank you, Michelle. That was wonderful.
Thank you.
So for Dr. Ostad, we have someone asking that while we work to correct our nutrition and drink more water, is there something topical that you can recommend for extremely dry skin?
Yeah, absolutely. I think it's so important. I think the single most important skin health that you can do in terms of, you know, maintaining your collagen is moisturizing. And, you know, women tend to be a lot better at it than men. I can tell you from my experience, you know, taking care of my patients who are men, they don't moisturize. So I think it's an incredible habit to get into, and moisturizing twice a day, morning and evening. And I think you want to basically, there's really no bad moisturizer. You want to basically use a moisturizer that has fair amount of lipids in them. And these are things we call ceramides. These are things that we call humectants. For those of you who need something like over the counter, believe it or not, for your body, something called like Eucerin cream. It's great. Even men can put that on their face. It's important to incorporate a moisturizer also that doesn't clog your pores for those of patients who have oily skin. So an oil-free moisturizer is great. It doesn't have to be anything fancy. It doesn't have to be anything that is expensive. One important aspect of a great moisturizer is something that has what we call niacinamide. Niacinamide is basically vitamin B3, and it basically helps to hydrate your skin really well. And sometimes you can find that over the counter, sometimes not. That's something that's available in the office for our patients. But moisturizing it is so important. Your basic skincare regimen, as much as you may not be going outside, should be using a very gentle cleanser, nothing harsh. Basically moisturizing in the morning, using what we call an antioxidant on your face. And these antioxidants are basically serums that contain vitamin C, vitamin E, ferulic acid, green tea. As Michelle said, you can incorporate those in your diet, which would be great for your skin. And at nighttime, you're basically putting what we call a retinol. Retinol is a vitamin A derivative that basically helps stimulate collagen. And then along with that, just being good to yourself, having a positive mindset and really just doing whatever you can to put yourself in a meaningful, positive state.
Thank you, Dr. Ostad. Michelle, question for you. Should post-menopausal women take multivitamins without iron? They read that iron in post-menopausal women is bad for the heart.
Great question. So iron in excess is very detrimental to the heart, but iron deficiency is also detrimental to the heart. So it really depends on what are your iron levels and what are your trends in your iron levels. So not just your iron, you want to look at your hemoglobin and your hematocrit and your MCV. Year to year. And if you see that it's titrating up or it's titrating down, you need to address that in your diet instead of it in your supplements. So I would recommend it more for food versus supplementation, especially in postmenopausal women. But that also goes to say, depends on where you're starting from. A lot of people are iron deficient when they become postmenopausal. And for that, it really depends on your exact levels.
Perfect, thank you. Michelle, another question. What are some other dark leafy greens that are as helpful as arugula?
So all dark leafy greens are wonderful. I pinpointed arugula because of the nitric oxide. It's actually the only dark leafy green that has a robust amount. I mean, kale and Swiss chard have good amounts too, but arugula is a little bit higher. Watercress is a little bit near arugula in terms of nitric oxide consumption, but garlic, beets, red cabbage also fall into the nitric oxide family that helps vasodilate those arteries and allow for proper blood flow. But every dark leafy green is going to give you a boost of some good nutrients. So I wouldn't just pinpoint out only eating arugula. Eat what you enjoy and what you like, and that will be a consistent leafy green that you can add always into your diet. If you haven't tried arugula, or it might be a little bit too peppery for you, you can do a little bit of it with something else that you like.
Thank you, Michelle. Thank you so much, everyone, for your questions. I hope we all got the answers we were looking for. Dr. Ostad is going to go ahead and wrap everything up for us.
So thank you so much for giving us a little bit over an hour of your time. It is a pleasure to be here, and thank you for participating and listening. I hope this has been helpful to you. Thank you, Michelle, for a beautiful job. Thank you for your information and being here. And we're here for you if you want to reach out, and Michelle is available through her website. You can find her online. We are here by certainly contacting us on the phone, and we wish you well. We wish you, beautiful weeks ahead, and I hope you and your families are all safe, and I hope that you hang in there, and I know we will certainly overcome this. Our thoughts and prayers are with people who have had a family member who've dealt with this, who's dealt with this, and certainly with people in the hospital. And I just want to thank each and every one of you for being here. And any questions, feel free to reach us. Thank you so much for your time.
Thank you.
Thank you, everyone. Everyone be well and take care of yourselves.
Thank you.
Thank you.